Podcasting from eHealth New South Wales. This is Let's Talk eHealth.
Welcome to Let's Talk eHealth, a podcast designed to showcase the projects and the people we have at eHealth New South Wales. Today we're talking about behavioural design and how we use behavioural psychology in digital health. I'm joined by Jarrah Watkinson and Loletta Cheng, both user insight specialists for eHealth New South Wales and psychologists with a background in organisational psychology. Welcome, guys.
Hi, Hannah. Thanks for having us.
Hi, guys.
Now, this is a really interesting topic because I don't think many of us realise just how critical psychology is to the work that we do here at eHealth, but also that we have real psychologists working here. So to start with, why do we have psychologists here?
So I think at the crux of it, we're designing for people, we're designing for users when it comes to digital health. And that's where we really need to really understand their behaviour, their thinking, their attitudes. And that's what as psychologists specialise in. So by understanding those human capabilities and those human limitations, we can make the health IT system that we're designing for safer, more usable, and actually support our clinicians and our patients' needs.
Right. So tell me, what is behavioural design?
Behavioural design, in a way, is about focusing on behavioural change. We're trying to make people do something different or to do something new. Now, this is because when we're thinking about even our own behaviour, humans are often not fully logical. We may say one thing and do another. This doesn't mean that we are inconsistent or we are not sincere. What it means is that there are often other factors that shape our behaviour.
Yeah, so just jumping in and adding to what Loletta was talking about in terms of those different factors. So these can be external factors, maybe the environment that we're in or the context that we're in, but also internal, our personal factors like our personality or our disposition or our previous experiences. So maybe to give a concrete example, let's think about exercising or maybe specifically going to the gym. Now, we might have the desire that we want to run a half marathon, but in order to do that, we need to have the capability to do it. Do we have the awareness of what we need to do for training to run the half marathon? Do we have the opportunity? Do we have the time or the money to go to the gym? But also, do we have the motivation? Why do we actually want to run a half marathon? What are our beliefs and our attitudes to undertake that behaviour? As psychologists, we know there are tools that we can use to encourage or to change a behaviour. So maybe running a half marathon using a commitment device. So signing up to a half marathon with a friend. We know from a lot of studies that if we commit to somebody else to do a behaviour, we are so much more likely to do it than if we just decide on our own.
Right. So then how is psychology or behavioural design used in digital health?
Yeah, that's an interesting question, Hannah, because when we first joined, people go, psychology, you design things. But then there's actually a lot more involved in a great design than just a pretty interface. So there's actually a really famous footpath example that helped illustrate this idea. Hannah, have you heard about that before?
No, I haven't. Take me through it.
Yeah, no problem. Now, just let's visualize that there's a park in your mind. Now, there's so often that there will be a really pretty concrete footpath designed for people to wander around the path. It could be about going to A to B. However, instead of using these footpaths as design, people often create their own shortcuts between like a line. Now, this is what we call the desired path. And this actually reflects people's need and behavior and how they actually behave. Because instead of wandering around the park, people maybe just want to go to A to B more effectively. So as psychologists, what we're here to do is really understand people's behavior and strengths, and also so that we can use this information to design for a path that suits them rather than having this pretty path that no one uses.
So what do you do then to understand these strengths or these desires? Do you engage with the end users?
Yeah, definitely, Hannah. That's one of the main tools that we do want to use in behavioural design is actually go out and interview or go out and observe our end users in their environments. They're such as doctors and nurses and subject matter experts as well. Yes, we want to speak to them and hear what they have to say, but we also understand why they do what they do.
So could you take us through some of the digital health initiatives that have used behavioural design here at eHealth?
Yeah, Hannah. So one of the projects that we are working on currently is actually the design of a new electronic medical record for intensive care units. So intensive care units are a really data intensive part of any hospital. So in an ICU, there are thousands of different data points recorded per patient per day. And this is often across multiple areas of a person's body. It might be their liver function or their kidney function, a lot of blood tests and so on. And as eHealth develops this electronic system for the neonatal and the pediatric intensive care units, it's really important that we make sure that we actually engage our end users who will be using this system, so such as the doctors and the nurses. New technology can really influence human behaviour in very complex ways. And so this is where also utilising psychological theory can offer a lot of valuable insight. So I can provide a really specific example here of how we applied psychology. When we were designing the medication prescribing functionality within this electronic medical record system, we initially hypothesized that doctors would prefer to search for the medications and find and select them that way rather than browsing for medications, probably because we're all used to Google and just basically Googling and searching for everything. But what we did is we actually did simulation testing. So we gave doctors a fictitious scenario and we got them to use the medication prescribing functionality to prescribe medication for their patient in this scenario here. And what we actually found was that having the medications in a list format in which, all the available medications were on the screen was actually preferred because it prompted and reminded the doctor of the other medications that they might also wish to prescribe the patient. So this really reduces the memory requirements and demands on doctors in this. This is quite a safety critical task. And also it's really beneficial to assist the doctors in their workload in such a, it's a very rapidly changing and a very intense environment in the ICU. So anything that we can do to reduce that, cognitive overload on our doctors.
So I'm sure ethics has come up from time to time. What does eHealth do to ensure behavioural design is used ethically in the digital health initiatives that we're working on?
Yeah, Hannah, I think this is a really good question, and it's definitely something that we always have at the forefront of our mind when we are utilising behavioural design in digital health. And especially as psychologists, we do also have a code of ethics that we need to align and abide by. Changing behaviour is important for many different health reasons. And, of course, we want to make the chosen path to do a behaviour the most desirable and easy, but also that it's the correct path or it's the correct behaviour that we are trying to encourage. But also at the same time, allowing someone enough space to make a different decision if they think the path we're directing them to, is not the right one or not the most suitable one for the situation. Of course, that has to still be clinically correct or right personally as well.
This is because ultimately what behavioral design is trying to do is provide designers and also policymakers with the evidence-based method and technique to shape people behavior. But there are also three key things we keep in mind throughout our engagement, making sure that what we do is ethical. Now, the first one is about social good alignment. This is about making sure that whatever behavior we're encouraging actually align with what the community and the society wants as a whole. For example, reducing smoking. Secondly, what Jarrah mentioned earlier on as well is transparency. Even though there's one pathway that we really encourage people to do, we still give them second and third option to choose from. And lastly, and most importantly, we have to ensure that what we're designing and recommending align with what the user actually want to do. Let's say, for example, if they really want to quit smoking, we're making sure that what we design align with what they want to achieve. So these are the three key things we keep in mind throughout our design process so that we are basically making sure that we're ethical throughout.
Right. And I guess for those of us working in digital health, what is the one thing that we could leverage from psychology in your opinions?
For me, I think is regardless of from a psychologist or not, one thing to keep in mind is that we are not the user most of the time. So we have to speak to the user, making sure that we do the research and really test our assumption because so often that our assumption is inaccurate.
I think what I would just add is, similar to Loletta, get out there and talk to the people that you're designing for, get their input, understand their workflows, get their feedback on your ideas. But also there is a lot of psychological theory and literature that is already available as well. So we don't always have to recreate the wheel. We can have a look at what has been done previously in psychological studies and maybe where can we apply that. But also I think just a caveat that context is really important as well in the environment that our users are in. design.
Well, it's certainly food for thought. Thanks so much for joining us today, Jarrah and Loletta. For the listeners, to learn more about behavioural design, head to the show notes in your app or on our website and search for human-centred design.
Thanks for listening to Let's Talk eHealth New South Wales. If you enjoyed the show and want to learn more, visit www.ehealth.nsw.gov.au.